Welcome to another edition of Thought Leaders Live, where we talk with thought leaders in business, life, and all points in between. Today, we're going to talk business and I'm sure a little bit of life with Alex Fernandez, CEO of Synergy Orthopedic Specialists. And today, we're going to talk about how to build a business that runs without you. Alex has got a lot of experience in this realm, healthcare executive, more than 30 years of experience building and scaling multi-site physician organizations. So, Alex, thank you so much for joining us today, and I can't wait to dive into the conversation.
Thank you, Greg. I look forward to it, and I appreciate your invite.
Sure. So let's start out with you. Let's give us the details about your personal journey and professional journey and how you got to where you are today.
Yeah. First, I'm not. My parents are not doctors, or I don't have any what we call physicians or healthcare providers in the family. So, and they're all in the retail industry, and I got into healthcare almost by mistake. I was going to college, needed some money, I would say, to buy beer and meet girls. I'm originally from Miami, Florida. So I said, I need to get a part-time job. Dad's not going to continue giving me money to go out on dates. So I ended up getting a job at a doctor's office in the front desk. So I literally started from the ground up, seeing how physicians that literally just were great clinicians, provide an amazing opportunity to heal their patients, their customers. But at the same time, when it came to the business side of things, it's not something they learn, not something they were taught, and in some cases, something that they're not really interested in. They just want to make sure the money comes in and they're able to put their kids through college and pay their mortgage just like everybody else. So that was the journey. Then I basically started front desk, learned the billing, I knew some accounting, so that helped. And then later on, I got my first office manager administrator role and started rolling out practices and so on and so on. Got my MBA at University of Miami in healthcare administration. And over the years, I've done roll-ups where I start with a couple doctors, add a couple more practices through acquisitions and mergers, and then later on have grown businesses where we've done exits to private equity firms. And so the full gamut, taking a business from a very small business, hundreds of thousands of dollars, millions of dollars, to hundreds of millions of dollars, and so on.
Great background. I want to just circle back to one thing, and you mentioned this to me before the show. Your parents' background, they are in the retail business. Mm-hmm. And specifically, if you can tell us what business they were in, why so you took some of the lessons from that and brought it to healthcare, because I think it's really interesting.
Yeah, I appreciate that. So the family business is in the bridal industry. So completely different, very niche business, even within retail. Basically every summer, and even as a little kid, grew up in bridal stores. But my parents, both my mom and my dad, basically built a business together. They worked alongside each other, very hard entrepreneurial people, and taught me around. That's how I knew bookkeeping in my first healthcare job, because I'd been doing bookkeeping since I was in my teen years, filing paperwork, writing checks, putting ledgers into the entries, and then eventually even doing QuickBooks and basic accounting and bookkeeping work for them. And that's how I got into healthcare. But also my dad in particular always thought about building managing and controlling as much as he could the upstream and downstream of revenue. So once he had the bride, he would say, well, if I have the bride, can I sell them or rent them tuxedos for the groomsmen and the groom? Can I go ahead and sell them the flowers? Can I sell the photography and so on? And basically try to control that upstream and downstream revenue and build a vertically integrated business. But he also understood that one location can have strengths and weaknesses on its own. So building a multi-site operation that the enterprise did not rely on one site, whether because it went, maybe, I don't know, the government says, I'm going to start reconstructing the road in front of your store. and all of a sudden the foot traffic is going to go down by 50 or 75%. That's going to kill that store. But if you have 5 stores, that won't affect the overall business. It will, but not in a major way that it could basically bankrupt the enterprise. You have other sites, and so he used the opportunity to move inventory between locations, and also again do the best thing for the customer and provide a great experience. It wasn't just about going ahead and saying, hey, I'm going to go ahead and sell you a gown, but basically managing the overall experience and be able to provide a great opportunity for that person, kind of like the one-stop shop. So now in healthcare, over the years, I have actually brought those systems and that playbook from the retail industry into the healthcare industry, where when I start working with a group of doctors, the first thing I'm trying to figure out is what is it that they control? What referrals are they sending out? And some businesses already have that in mind. In Durham, for example, when I went to New York City and acquired a couple dermatology practices, they were sending out a lot of pathology. So why not build a path lab and keep that business in-house and generate some additional ancillary income from it? It might be somewhere they were only doing medical dermatology and very little cosmetic dermatology. How do we train them, or how do we find additional staff that will be able to do injections and be able to basically facilitate the growth of that part of the business within the enterprise? And then also making sure you have multiple locations. So in case, again, one location goes bad, the other one will be able to support, the other ones will be able to support the enterprise. So it's business is business at the end. I always said, yeah, I'm in healthcare, but I could probably have been running any other enterprise as well. Because at the end, you just want to make sure as an entrepreneur, you get yourself out of the way, hire really smart people, bring them on board, have them do what they need to do. Almost get out of your own way. You have this dream, this idea, you started it, you took it to a certain level. You need to bring other people into the enterprise to make sure that they continue growing the business that you've created.
We're going to get into that mind shift from operator to owner, but I want to circle back to the physicians themselves. And I was a copywriter early in my career. I've always been a writer. And what I loved about marketing and advertising was it gave me a chance to kind of be an artist and, write, which is there's my talent. But I think with medical practitioners and the people I've met, they just want to be doctors. They want to practice medicine, and they don't want to deal with the business end of thing. And I've seen other writers who don't want to get involved with the marketing end of stuff, and they just tell me what to write. I see a parallel. I think the practitioners are kind of like artists. They want to practice. They want to do the work. And then now you're bringing in the necessary evil, right? You got to have patients walking in the door for that to happen. And I guess, how do they get to that? First of all, how do they get to that business mindset? And how do you kind of coach them over there? I mean, I think it would be pretty easy. Like, you're not going to keep the doors open if you don't have people coming in. But do you see that kind of mindset?
It's actually quite hard. Yeah, it's quite hard actually, because they're very smart individuals. Physicians have studied for a long time to do things in a certain way based on how they were trained. So, for example, in orthopedics, you would say you have a back problem, and maybe right now to stabilize the problem, you need a brace, and you get a back brace or a knee brace, and that's a selling opportunity, whether paid by the insurance or by the patient. It's a selling opportunity. So you would think, hey, provide this service or provide this unit, they'll get better, and you'll make some money. But some physicians have been trained maybe to say, well, a back brace and this level of care, it's actually not a good thing because it could weaken the back, and it will worsen the original problem. So there's always a dichotomy of, is healthcare, clinical care, my education, my training come first, and I'm doing what's best for the patient. And then some doctors believe that the business kind of gets in the way, we're trying to sell something. Maybe we're overutilizing physical therapy or imaging or whatever. So I think the right balance is the physician that understands both worlds really well, understands and can dissect and review a profit and loss statement, as well as be able to provide great clinical care. So I always think it's my job is more around the experience. Some doctors will use the X brace or they will use XPT or X MRI or whatever. So I think it's right. My job as a CEO in the organization, the business job, is to make sure they have all the tools that the doctor wants at any moment and allow them to pick whatever tools they want. Try to negotiate the best rates from the beginning. From a marketing perspective, have all those opportunities. Make sure you have a good funnel business, whether you're marketing or doing outreach or doing contracting with payers so that they refer business to you, or building relationships with primary care doctors, and sometimes pulling them along the way because they just don't have that business acumen or experience. But some actually want it and some don't. And I think the reality is most physicians actually, like you mentioned before, creative people, they want to just do work. They want to be able to have that creative experience, and freedom more than anything, not just the experience, but they want to have creative freedom to do what they think is best. I call it in healthcare kind of doctors want to have it their way, or the Burger King program. I want to have this and I don't want that. I want to do it this way. I don't want that way. I want an assistant. I want a physician assistant. I want 3 medical assistants, but I want athletic trainers. So the hard part is you can't, in a business, simplification, standardization actually yields better outcomes and it yields better profitability. So it's always that balance of trying to get them have enough flexibility and at the same time have, and I almost think it's almost like an 80-20. 80% of the process is very standardized systems, et cetera, and 20% has a little bit of leeway for the physicians to feel and to provide the care that they specifically want, and to be able to provide a very unique experience for the patient. Not every patient's the same. Not every patient's, they're similar, but not the same. So you want to make sure that there's a system that allows them to do both.
Well, we could go do a whole nother show on standardization, but I think it's
Yes.
smart what you're talking about in terms of helping them standardize the business process and how they grow their process. And the bridal method is as good as any I've ever heard. But let's get into, they have the mindset, they want to grow the business and really get into that shift from operator to owner, and talk a little bit about what you call the 2-week test.
Mhm.
And that reveals whether the business is truly dependent upon you. And why is it so wrong if the business is truly dependent upon you, Alex?
And I would say even the 2 weeks is like the basic test. The 3 and 4 week is the real test.
Okay.
Because particularly in healthcare, if the business 100% relies on the individual, and this kind of goes back to that multi-site operation business, if it only relies on you, if you get sick, if the business for whatever reason there's a change in policy, then you as an operator are going to feel that pain that comes from whatever that change was. So if you build an infrastructure that where again you're trying to control or at least have opportunities to earn revenues from ancillary streams that you are now owning as well, and then you have whether it's other partners, other physicians that are working with you, extenders, and again in any business it would be salespeople, other operators, etc. In the business set up in a way that yes, you represent part of the business, but you are not the whole business. You'll be able to escape and go on vacation for 2 weeks and not worry that the whole business is going to crumble and actually lose revenue. It might lose some revenue because you're a big part of that, but it won't completely fall apart. And I saw that early on. And again, going back to this is interesting this podcast today with my parents. They would always we lived in Puerto Rico. That's where I grew up. And early on, they have multi sites. They would go on these extended boat trips through the Virgin Islands from Puerto Rico. and would go for 1 or 2 weeks.
Awesome.
And I remember this as a kid. We'd go for 2 weeks, and I would remember at the end of the day, around 5 o'clock, or right around when the store was closing, my dad would call the store. There's no cell phones at the time. This is in the 70s or early 80s, and they would call the store from one of the islands, and go talk to the managers or multiple managers, and say, well, how do we do today? How are things going? Oh, well, things are great. We sold X amount. We closed the register, closed X amount of sales. And they're like, okay, things are good. Let's keep on rolling. And the book kept on going. And the patient got extended. And it literally was, should we turn around, or literally another call would go and say, how are we doing today? How did we do in sales today? And it was that daily KPI. It was very rudimentary, very verbal. There are no computers. People are
Mhm.
using it, literally, an electronic cash register and paper tallies on sales orders. But it was that, let me check how things are going. And as long as everything was well, the vacation could be extended. And I think I learned that early on. So it's funny enough, my wife and I are going to Europe in a couple of weeks,
Awesome.
for a 2.5, almost 3 week vacation. And my plan over the last couple of days has been try to figure out if there's any gaps in coverage, things that I only do that
Hmm.
somebody else could do for me. It might be I approve payroll, but let me go ahead and give that approval process to my director of HR together with my controller for that period of time. It might be I need to sign checks. Well, I make sure that I have another person that's going to sign. One of the other officers in the business knows I'm going to be out, and they might have to sign some physical checks. Granted, we primarily do everything through ACH and electronic payments and things like that. So you have to also think from that perspective. How do you get yourself out of the equation? Hire the right people, hire the right talent.
Well, Alex, take me back to the 2 week test then. Is there something that you actually have somebody do for the 2 weeks?
Well, I think it's everything you do. What is
Okay.
it that you do? And you almost have to lock it all down and figure out what is it that you personally do in the business that you can delegate, outsource to another individual regularly. The test is the 2 weeks or the 3 or the 4 weeks. The reality is, as an owner, if you're spending time on running reports or trying to understand the business, or more importantly, sales, if you're the number one salesperson in your business, how could the business survive without you not selling for another month?
Right.
Or if clients are going to call you and you won't be around to be able to answer the calls. And again, 2 weeks, 3 weeks, 4 weeks, I think it's more important when you are out of pocket. Like I just mentioned, Europe, you completely are in different time zones. You can't really engage with people. You're not going to start having meetings or with teams at 3 o'clock in the morning. 3 o'clock their time, and so on. So I think it's developing that list of everything that you personally do, almost your scorecard, your job description, and say, okay, who can I delegate these things to forever?
Right.
I know every business is not they're all at different stages, so the business might not be able to support that, but you might have a business that has 3 people, and then that's it, and you can't really delegate to anything. So the question is, how do you continue growing the organization to be able to build an enterprise, and then how do you scale it up by hiring the right talent for all the different areas that eventually you want to replace yourself? Because also, if you're building to do an exit at some point in time, you're not going to be there when you sell the business.
Yeah.
So
Right.
the operator or the organization that's going to buy the enterprise is going to want to buy a business that has true earnings before the partner or the owner gets distributions. That's really where the EBITDA
Right.
lives. So you want to make sure you build an organization that has that in place.
Let's segue over because you mentioned processes. Talk to me a little bit about why the scaling broken processes, broken, only creates bigger problems, and what you should do to fix those before you pursue that growth
Yeah,
track.
every business needs a playbook. Um, and what I mean by that is, like, The same thing happens when you go on a plane. The pilot goes in and has this checklist of everything that needs to happen prior to getting the plane to take off. It might be a sports team. They need to know what their adversaries are. They need to understand where their strengths and weaknesses are. They need to understand their own strengths and weaknesses. And they need to develop a playbook with all the different players in sight and their team, and understand where are the strengths and weaknesses of their own operation and their own business in order to be ready for that game. So all businesses need to do the same thing. The playbook in healthcare is what happens when a person calls your office and wants to see you, i.e., there's a lead. And I know doctors don't necessarily look at it that way, but there's a lead that just occurred. It's on the phone. And what are you going to do to convert that lead into a revenue generation opportunity? What is also your cost to generate from a marketing perspective to convert that business, number one, to capture it, and then to convert it into a sale? And what's your conversion ratio of how many people call you to the number of people that are going to actually convert into actual clients? What's your overall cost for the first episode, revenue for the first episode, profit for the first episode, and also for the lifetime of that client? And make sure you have all the opportunities to continue re-engaging with that customer. So when they need more of whatever it is that you're selling, they come to you and not the competition. So I think it's a playbook with all these things in mind, but it literally starts with something as simple as when they call you or they engage with you. It might be on the website. We make a lot of appointments that are basically do it yourself. Patients go in, they look for the provider based on I have knee pain. I know that my ACL is kind of messed up because I've been running or playing football or whatever. And then I need to go find the right physician with my insurance. They go through that whole process. They go through the whole funnel of the process to get into the office. They find the right, but if you don't manage that well, and they do everything right, and you don't have a staffer that forgot to say, I'll accept the patient visit, or I'll make sure the booking is approved, or they didn't verify the insurance and say, oh, by the way, we don't take that particular insurance. We're not part of that plan. Or any of the multiple things that happen in healthcare that need to be managed. The experience could go wrong and the patient's going to be upset and they're never going to come back to you. And your biggest referral, your biggest opportunity for generating more revenue is referrals from your current customers. So you have to build that network, whether nowadays on social media or you have building that network on Google, or even more important now is LLMs are telling people where to go. So when you do your search, is the AI going to say you're not necessarily the best place to go because they're looking at Reddit and some of the other sites out there and saying people don't necessarily respect this physician or this operation. So managing that whole process, soup to nuts, from a marketing perspective, operational, finance, HR, purchasing, etc.
Yeah. Well, Alex, tell me a little bit about why you've been successful. Okay, because you said this isn't rocket science. I'm not really doing anything entirely different. And does it tie into this? One of the things we wanted to talk to today was about operational discipline.
Mm-hmm.
And do you think that's a big part of your secret to success?
Yes, I think that there's a lot of things. I think that number one, I'm just a very hardworking individual. My parents built I would say, a foundation for work ethic it's sometimes it's hard to find even with individuals in your own organization. I'm very happy when I see I would say younger staff members that you see them eager to learn, eager to grow. Sometimes it's hard because we might not be the right outfit and we're just a stepping stone in their career. So, but I'm always happy to see them move on. And, every so often at national conferences, I might bump into somebody that worked for me at a front desk, which right now they're a director of operations, or they're a vice president, or they're actually running a medical group. So I'm very happy about that. But going kind of back to the playbook idea, I feel like you have to develop. First, you have to understand your business. You have to have a strong business plan that you look and manage and update regularly. It's not just, let me build the business plan when we first started the business, but the business has grown and changed over years. I always look at an enterprise or a business is like a kid. If you have a business at 1 year old, it's like a 1 year old. If it's 2 year old, it's like a 2 year old, and they literally act in that manner. If it's a 10 year old, that's what it is. And if you're 25, maybe it's a little bit more mature, but you're still trying to figure it out.
Yeah.
And if you're 50 years old, then you have to figure out what you didn't do well or right, because you might want to go back to what you were doing when you were 25 years old to try to what made you successful that got you
Yeah.
there, because now you have the 25-year-olds and the 12-year-olds kind of like bidding at your heels and taking
Yeah.
business away from you. So
Yeah.
you have to have this very good discipline around tracking, managing, developing again the KPIs, developing the playbook, understanding where your business is and where it's going, and have regular cadence with yourself and the other business. It might be you're the sole owner, but you have 3 or 4 people you depend on. And when you don't think about having meetings on a regular basis, but maybe you have to have a 6 month meeting that says, well, these were the goals at the beginning of the year, and we've achieved some, and here are the opportunities. This is what we've accomplished, but these are the things we haven't. And how do we get there? How do we improve the business? Who do we want to be when we grow up? Where are we going next?
Yeah.
And you have to have the finance and the the leverage to be able to continue growing, the EBITDA and leverage to grow.
Alex, let me ask you one more question along these lines. And I think it's kind of interesting because we're talking about healthcare here. And I had somebody on the show a few months back talking about the customer experience and going to a doctor's office and the how horrible each step of the customer experience was. And it she got so angry. And I
Mhm,
think it like adversely affected her health.
mhm.
And I just wonder your experience working with medical professionals, do they understand that that a healthy business actually makes their customers happy, could
Mhm.
have positive health results, and makes their employees happy and can have positive health results? Is that something that isn't even on their radar? Because I think it could actually be a real thing and is a real thing.
Yeah, I think I don't. Particularly, I've worked with multiple specialties. They're all very different in the way that they've been trained and kind of brought up in the business. More importantly, um, I'll tell you how we do it and how I always implement it in different organizations. In healthcare, whether the insurance or the individual pays cash, they have a choice. Sometimes they don't perceive it as they have a choice, but they actually do. In our market, there's 25 orthopedic surgeons in my group, and there's probably like another 200 physicians, orthopedic surgeons in our market in San Diego. So that tells you that we do have a significant concentration of market share, but we are not the whole market. So therefore, we start by saying when people answer our phones, we ask them to say, "Thank you for choosing Synergy Orthopedics." I want both the patient to know that we know that they had a choice, but I also want to remind the staff to let them know that we had a choice. Um, from that point forward, we're always talking about providing outstanding medical care and an exceptional healthcare experience. And they both have to be together. People come to us particularly, and I worked in cardiovascular care, gastroenterology, dermatology. People are not coming to us because they're happy. They're not coming for a well visit, annual checkup. Everything's okay. I just want to make sure my labs are good and just want to check in, doctor, with you and see how things are going. With us, they're in pain. They have gut pain, they have knee pain, they have hip pain. If they're dermatology, maybe they have acne and they have rashes and psoriasis and inflammations and so on and so on. So in heart, they have varicose veins, or they might have just all kinds of pains. We're in the pain business, whether physically, I do have pain doctors, or just in general, relieving pain. So they're coming to us at a pretty vulnerable state. They're weak in the experience, and then here you come and exacerbate the experience by the first thing when people answer, they're like, "Hello, doctor's office. You want an appointment? What's your phone number?
Yeah.
What's your date of birth?"
Yeah.
Even going to the pharmacy, and I don't have to name brands. Everybody knows this. You go to a pharmacy, and the first thing they ask you is, "What's your name and your date of birth?" Not, "Hey, how are you?" Because there's a queue of like 15 people waiting in
Yeah.
line to go get their prescriptions.
Yep.
So the experience in healthcare, and I try to have my recruiting team always, if they find people that had, even if they have healthcare experience, but somewhere along the line they had, whether it's retail experience or hospitality, restaurants, they worked at the person, the most humble person is the one that was a waitress, or worked at a location where they had to provide the front desk at a hotel. They had to deal with so many other problems when, again, people are in need of that solution, whether it's I need food or I need a place to stay or whatever it is, and things always go wrong. The food comes out cold or not cooked enough or cooked too much or whatever. Being able to engage with the person and say, okay, don't worry, I'm going to take care of this for you. In the past, when our organization is a little bit bigger and we have a little bit more budget, I have hired Ritz Carlton. They have an excellent training program around education and training. And literally, we close all the offices and bring hundreds of people to hotel rooms and have our own symposiums around customer care and providing the best outpatient experience, because there is a choice. They could go to the hospital doc. And sometimes those hospital docs, they're employed by the hospital. They also control the primary care referrals. So if they end up somehow with us, we have to make sure they know that we're going to be out there. And the biggest complainer, I would say, in our business comes from the misunderstandings of the complexities of insurance. You pay thousands of dollars a month for insurance coverage, and then you find out that doesn't cover anything for the first $7,000, which you were expecting it to do. And then somehow you take it out on the provider that gave you care. Right. And we'll check the insurance and say, oh yeah, for today's visit, depending on what happens, and I think it's the hardest thing is depending on what happens, I need to collect up front $150, and this is almost like a deposit. There might be a bill coming later on for the difference. And patients get very frustrated because, number one, they think the insurance is going to pay the whole thing. Number two, why can't you tell me exactly how much you're going to charge me? And the reality is we don't know, because insurances have their own algorithms on how they're going to pay, what they're going to pay. Sometimes you think something is going to be covered, and then they come back and say, oh, that's not necessary. We're not paying for that. And they're like, the patient now has to pay for it. So a lot of times they don't get frustrated with the payer, the insurance company, but they do get frustrated with the person that's providing the care.
Well, Alex, it's very refreshing to hear the focus on customer experience. I also think that whenever I meet somebody really good in business, I always find how uncanny it is. They can take a lot of these kind of complex concepts and boil down to some what sound like very simple, common sense solution. And I think you have the track record, and just from chatting with you today, that proves you have that quality. So kudos to you and continued success. And if somebody wants to continue to work with you, or start to work with you, I should say, how do they get a hold of you?
Yeah, I would say, I'm not necessarily selling wares at in my life. I'm the CEO of a medical group, but I always love to connect with people and figure out if I can be of help of any kind. I'm available on all social media platforms, LinkedIn, Instagram, etc., and they're all the same. It's Alex Fernandez, MBA. So hit me up on LinkedIn. Probably it's the best format, and look forward to engaging with your audience.
Okay, Alex, thank you again for joining us today.
Likewise, thank you for inviting me.
And thanks to everyone for joining us for another episode of Thought Leaders Live. We'll catch you on the next one.